Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Welcome to Business Innovators Radio. I'm your host, Ken Sherman. I recently had the privilege of interviewing Jillian Trulson, a physician's assistant from Pivonka Health Wellness, a vertically integrated wellness clinic that provides pain management, rehabilitation, and chiropractic services, all under one roof, sort of a one-stop shop for what ails you. In this interview, we discuss pain management and how non-surgical options are effective in treating patients safely and without addictive narcotics. Let's get right to the interview. Good morning, Jillian. Thanks for being on the show today. So tell us a little bit about your perfect prospect. Who is it that you're able to help?
I help anyone that is in pain for the most part. Anyone that's in chronic pain or in acute pain, they can come to me and we can help get them out of pain. Mainly we see people with neck pain and back pain and also headaches.
And what treatment options do you have for somebody living with pain?
We can do injections, something called trigger point injections. We have braces that we can provide people. I do joint injections for any knee or shoulder or hip pain, and I do that with ultrasound technician present. And we also do occipital blocks for headaches.
So the treatment options you provide are really all non-surgical treatments. Is that correct?
Yes, that's correct. Our whole purpose is to keep people away from surgery and to try to get them out of pain with just less invasive procedures.
Jillian, I'm curious, how did you get started in the medical profession?
Initially, I was looking into going to veterinary medicine. And so in college, I was a veterinary science major, and I ended up needing surgery on my wrist. And after my surgery, my surgeon asked me if I ever wanted to look into human medicine. He would allow me to shadow him and asked if I wanted to shadow him. And so I did. And while I was shadowing him, I got the privilege of working with his PA. And that kind of opened my mind to the field of a physician assistant, and from there on, I kind of changed paths and went into human medicine as a PA.
Well, what sparked your interest to be a veterinary technician? Or was there some time in your past when you knew this was the career choice for you?
So I always have had the need and want for helping, whether it be people or animals. I feel like I'm just a very caring person in general, and I feel like if I could put my physical abilities to use, it would be to help people or animals get out of pain. And so that was kind of always my draw. And initially it was veterinary medicine because I just love animals. But then as I started working in veterinary medicine, I realized that a lot of it was not so much helping the animals as it was, putting down animals. And it was actually really depressing for me. So that's kind of when this all worked out for me when I had my surgery and another opportunity presented, and I could see that I could use my abilities for actually helping people, and that's kind of when I switched into human medicine. I feel like with human medicine and insurance, I had more opportunities to actually provide care and help them.
Jillian, I'm curious, what personal attributes or traits do you think you have that sort of lend themselves to your success, and how were you able to develop these through your life?
So when I was younger, I started gymnastics at the age of 3, and I continued in gymnastics all through my early 20s. And through gymnastics, there was a lot of injuries, not just for myself, but for my teammates. And it was really the medical providers that were there that were able to help get us out of pain. We're just mentally there for you and to support us with anywhere from physical therapy to PAs to doctors. They really made a difference in our whole team. And so that's kind of what sparked my interest initially, and that's kind of where I developed the empathy and the want to help people, because I felt like they were always there for us, and they kind of helped pave the way for us to continue doing the sport that we loved.
What's the growth of your professional career been like over the last couple of years? I know you've recently graduated medical school. What's it been like your first couple of years out?
The last couple of years have been amazing. Since being a PA, I feel like I've really found my passion. When I graduated from PA school, I started working in pain management at Pivonka Health Wellness, and I've loved it every day since. I love the patients that we have. I love the atmosphere that we provide. I really love the fact that people come in wanting to get better and that we're able to provide those services for them, and they're able to leave our office feeling much better.
Were there any roadblocks along the way to getting your career started? Did you have any trials and tribulations that you had to go through to finally see success?
PA school in itself is very tricky. It's definitely no walk in the park. I spent hours upon hours studying and furthering my education. And then things got a little more difficult as I got pregnant. In PA school, we started our family, my husband and I. And so there was another stress kind of added on as I was furthering my education. Once I got out of PA school, I kind of felt like I could take on the world. And since I've been working, we've added another child to our family. And so I think at times it can be stressful, juggling a family life and a working life and finding that balance. But I wouldn't change it for the world.
What are some of the common misconceptions or myths about the medical pain management services you provide and the results they can bring?
I would say the biggest misconception is when people hear the word pain management, they automatically think of opioids or narcotics or use of medications to get out of pain. And that's not what we do here at Pivonka Health and Wellness. We try to avoid medications at all costs, especially addictive ones. And we try to get to the root of the problem instead of masking the pain with medication. So we really try to figure out what's going on before treating people. And we try to use procedures that are going to get people out of pain so they don't need to use a chronic medication.
What do you think the reason is somebody you might be able to help, maybe the person you could help the most, decides not to call you for help? Is it, the expense? Is it, they're afraid it's not going to work? What are some of the reasons people don't seek treatment when they're in pain?
I think that people kind of relate pain management and pain to opioids, and there is some fear about starting opioids, and they kind of feel like that's the only option. And a lot of people choose to just stay in pain opposed to starting an addictive medication. So I feel like if people knew more about what we did here, I think that's it, more lack of knowledge of our services, that there is other options for them. And, pain management doesn't just mean opioids and narcotics. We can actually really do something to physically help you without any of those medications. And I think that's probably what prevents people the most from coming in, is just not knowing that there is something else out there for them.
Tell me about a time where your expertise and training really made a difference for a patient there at Pivonka Health and Wellness.
We've helped a variety of patients, anywhere from acute back pain to acute migraine, but particularly one patient stands out that, barely could walk in our door to begin with, in tears. And with the chiropractic side here, we have a combo, a chiropractic and a medical side. The chiropractic side was able to help structurally improve this patient's spine, and I was able to help get him out of pain. And for someone to walk in your door in tears and then be able to leave that same day, walking straight upright, no tears, telling me they feel great, and for that to be sustainable, that gives me the most joy.
Are there any special considerations a patient should think about before deciding on a pain management clinic or a pain doctor?
Yeah, I definitely think that there's considerations. I think that it's important to really get to know your provider and to feel comfortable and to make sure you're not in a situation where you're with a provider that, is kind of quick to jump to procedures and surgery, because there are other options. And I think it's important that patients know that there's other options and that they're educated in what their options are.
How could someone reach you that's in pain right now? What would that first appointment look like?
Sure. If someone that's in pain right now, if they call our office, Pivonka Health and Wellness, and schedule an appointment, we usually get people in same day. At that appointment, I would first do a thorough evaluation. I would get to know the patient and see kind of what's going on, get to the root of it. There might be images that are ordered, X-rays, MRIs, etc. And then we can go on with procedures from there if needed. Trigger point injection, occipital blocks for headaches, joint injections, if there's any joint pain. It's just depending on what their issue is. We have a specific protocol for each.
And then you also have all of the physical rehabilitation and the chiropractic services there available at Pivonka Health and Wellness all in one spot there, correct?
Yes, that's correct. So you kind of get a 2-for-1. You get the chiropractic side where they can help your spine and structurally, which also helps alleviate lots of other problems, including headaches and allergies and numbness and tingling. And then they also have cervical traction and lumbar traction to help improve the spine structurally as well as get you out of pain. And then we also have physical therapy exercises where we use TheraBands and core exercises to help maintain that proper structure and that proper posture. And then we have the pain management side to help you along the way if you're in pain.
Well, Jillian, thanks so much for taking time out of your busy day. I know you're an active clinic there and just sort of broke away for our quick interview. I appreciate you taking the time, and it's been a pleasure speaking with you today. Thanks for being on the show.
No problem. Thank you so much.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.